Good afternoon, everybody. Good afternoon. It's so good to see you all here for this wonderful session. I'm so glad to hear you all. Or see you all. I really, really hope that if you haven't already, that you will take this some opportunity this week to get outside just a little bit, take some really deep breaths because the weather is incredible. I know that everyone is beyond busy, but I strongly encourage you to do it. Just for a few minutes, take a walk, grab a bite to eat outside, something. It's beautiful out and you will not regret it. So today, I am so pleased to be able to introduce to you all Dr. Evan Cohn. Dr. Cohn is a retired radiologist following a 17-year career practicing in Dallas, Texas. Dr. Cohn attended medical school at George Washington University. He completed a transitional internship at Fairfax Hospital. And Dr. Cohn completed radiology residency and a musculoskeletal fellowship at UVA. While in practice, Dr. Cohn was honored to be voted one of the best doctors in Dallas by D Magazine multiple times. Dr. Cohn is here to share his experience of moving from the position of an actively practicing radiologist to an actively practicing patient. While we all do our best to practice sympathy and empathy with those we serve, no one anticipates this dramatic shift in perspective. I think we can all recognize that dramatic shift. And how startling it must have been. So our hope today is that we can all learn from Dr. Cohn's unique experience, both personally and professionally. So Dr. Cohn, we welcome you and we value the opportunity to learn from you. One more thing, if you all don't mind, usually we just pop in with questions, but if we can just get through the presentation, unless it's super, super urgent, and save questions for the end, I think we would all appreciate that for this session. Take it away, Dr. Cohn.
Right. Thank you very much, Dr. Worker. Appreciate that. What would you do if you faced an acutely life-threatening injury with about 50% mortality? I'm here to talk to you today about my experience, my family's experience, how you as a friend, family member, physician, healthcare team member, medical student, can make a difference in people's lives and really try to treat people the way you'd want to get treated. And I also hope that you see that life can change in an instant. My story, I'm coming at this story really with two different perspectives. I briefly wanted to touch base with you regarding just some of my experience as a radiologist for 22 years, and then being a patient starting in October 2015 and really still a patient. Wasn't sure who the audience would be, if there would be some medical students in the audience. I just briefly wanted to just go over some of the things that I learned that I found helpful, and just some practice suggestions I learned. And just, obviously in my opinion, just work hard, arrive early, stay late, attend meetings. Just don't just be a worker bee. Try to help with your practice. And I think also talk with your colleagues and share good cases. And I think it's important to get other people's opinions on things, not always, but it's also good to get, at least as a radiologist, it was good to get up out of my chair and go talk to another colleague. And I think it helps you learn and also helps you find things interesting. I think also it's helpful to continue to consult your mentors for advice. I had I did my residency and fellowship at UVA, and at least for the first few years, I would contact my previous attendings and just get their opinion on difficult cases, and that was very helpful. Again, some of these things apply a little bit more as a radiologist, but I think it's important to limit your differential diagnosis to 3. That was one of what my attendings would say. You don't want to give a big list of things. You want to be as specific as possible. And along the same line, she would say, one of my attendings was, if you're 95% certain of something, call it one way or the other. If you're 95% certain that it was, you're positive, 95% certain that something was negative, call it negative. You may be wrong 5% of the time, but at least you're useful and you're not going to be wishy-washy. And I thought that was very helpful. And again, it's okay to be wrong occasionally. And I think you need to be comfortable with that. I think it's also helpful to keep up with the literature. I would have in practice, your education doesn't end at when you finish graduating medical school or when you finish your residency or fellowship. It's important to just keep up with the literature so you can keep on learning things because things always change. I always felt it was helpful to have a niche. You need to be able to do everything in your practice area, but it's always helpful to bring something different to the group. I was a musculoskeletal radiologist, and I brought a lot of pain management injections to my group, and that was very, very helpful. I think it's important to realize that, just as in life, nothing is perfect. No practice is perfect. No university department is perfect. And I think it's important to realize that. And then lastly, again, treat people the way you'd want to get treated. And just want to briefly bring up, I started radiology residency in 1993 and again finished up in 2015. And during that period of time, we were using films and went to monitors. The slice thickness for a CT was 10 millimeters, went down to 2.5. It's probably thinner than that. There was no commercial 3 Tesla MRI at the time. And now, it's pretty common use to either have a 1.5 or 3 Tesla. And then obviously the marked increase in utilization of imaging. And again, I think it's important to realize, and that's part of the reason I think we went into medicine, that it's always changing and you need to keep up with it. And I think that's important. So that was just a few brief things I just wanted to touch base on from my perspective as a radiologist. Main part of this talk is my perspective as a patient, which started in 2015. And I do photography as a hobby, and so I'm going to have some photos along the way of photos I've taken. So my story begins October 26th. Really, my family story begins October 26, 2015. We were actually we were celebrating an anniversary, our 24th wedding anniversary. And we were actually at the Homestead Hotel in far Western Virginia. We went there a couple times when I was a resident and fellow, and we actually went a couple times when I was in Dallas. It's a sentimental place for us. And so we were planning on just taking, I think, probably a 4 or 5 day vacation there. This selfie was taken at 10:26 in the morning on October 26th. And you can see we're enjoying ourselves. Nice fall colors behind us. And about an hour after this photo was taken, I had the sudden onset of the worst headache of my life. I got nauseous, I got sweaty. And within about 15 minutes or so, I'm like, I couldn't get comfortable. I went out to the porch, I went laid down. I just couldn't get comfortable. And I knew that I needed to go to the emergency room. And I'm not the type of person that needs to go to the emergency room. But again, I do want to point out this picture, I think, is extremely powerful. We have this photo at several places in our house, in that you have no idea in life what's going to come your way. And, an hour after this photo was taken, I basically suffered an injury where I was not able to ever get back to work. I faced an injury with about 50% mortality. So I was taken we went over to Bath County Hospital, Bath County Emergency Room, and it was such a small hospital that I didn't know. I remember getting up there, I'm like, I'm not sure there's a CAT scan here. They did have a CAT scan, and actually I got very, very good care there. After about an hour and a half or so, they did get a CAT scan of my head. And again, for everybody, for patients, this is the front, this is the back, this is the left, and this is the right. And basically I had a large subarachnoid hemorrhage. And basically all this white stuff here centrally in the kind of the basilar cistern region, extending to the base of the right sylvian fissure, extending into the anterior hemispheric fissure, all this white stuff is all blood. I had it should be dark, like this is cerebral spinal fluid in the temporal horns. A little higher up, there's a little bit of blood layering along the tentorium here, and a little bit of blood in the foramen Monroe bilaterally, and a little bit of blood layering posteriorly within the occipital horns. I do want to point out, because I'm going to show you another CT here shortly, that, everything else there, the ventricles are of normal size. You can see the normal gray-white differentiation. You can see the normal sulci and gyri. So I had a big subarachnoid hemorrhage. The common causes for spontaneous subarachnoid hemorrhage, probably about 85 to 90% of the time, is a ruptured aneurysm. And then about 10% of the time, it's probably a ruptured vein, and then very small chances it could be arterial venous malformation or amyloid angiopathy. But most of the time, it's an aneurysm. So I do want to take a step back and talk about the care I received at Bath County Hospital, and again, how they likely saved my life. One of the people was the CT technologist. He did an incredible job and likely saved my life. And I know that by how he acted and how quickly things moved after I got the CT scan. So I remember him wheeling me back to the scanner, and on the way back, he knew I was a radiologist, and I remember him saying, "Well, when we're finished, I'll show you the scan." And I was like, "Oh, thanks, I appreciate that." So I remember getting off the scanner, and I remember getting onto the stretcher, and I said, "Oh, you're going to show me the scan?" He's like, "No, we're just going to send it off." So I was thinking to myself, that's not good. And then maybe about 5 minutes later, after I'm back in the ER, they come in, they put a second IV in, and they do that just in case you crash. They want to put one IV for fluids, one IV for meds. And within about 15 minutes or so, the ER doctor comes in and he said, "Well, it was really good you came in today. You have a subarachnoid hemorrhage, and there's a helicopter on its way from the University of Virginia." And so I know that he saw the hemorrhage, notified the ER, and sent it off stat. If he had not done that, I could have been there at least 2 or 3 hours. And, it's a patient with subarachnoid hemorrhage, there's about 50% mortality, 50% mortality. And so, and again, there was no radiologist there. So I just would have went into a pile. And again, I would have taken 2 or 3 hours probably. I did contact him maybe 6 months after, and I said, "I think you did this." He said, "Yes, I remember you." And I did do that, and I thanked him for it. And he's actually been an inspiration for me. I've given this talk now about 100 times. Of that, probably about 10 of them to 10 state radiology technology societies, partly, basically, importantly, telling them that they're an important part of the team, and that that you're not just a button pusher, and you can make a difference in people's lives. I also remember the ER nurse, was really very nice. And she, I remember getting ready to go off to the helicopter. She asked if she could pray with me, and I said sure. And I think, to me, she knew how serious this was, and I think any prayer is helpful. I also remember being in the helicopter waiting for it to take off, and I can see it to this day. I just remember being there and like, I'm not sure if we're going to make it. And my wife was not able to come on the flight. They didn't want her flying with me. So I remember texting her and saying, I love you and I hope to see you soon. But again, seeing your life flash before your eyes like that definitely makes you a better person. So, I clearly was in the right place at the right time. The CT technologist saw the hemorrhage. In addition, I think this is partly me trying to control the situation. I asked the ER doctor what's going to happen to me when I get to UVA, and they said, "Well, they're just going to probably drop you off there." I said, "Well, I still know people there. Can I contact them?" So he said, "Sure." So I contacted one of my attendings. He basically, said, "I'm going to need a neuroangiogram." He said, the people, Lee Jensen and Avery Evans were the neurointerventionalists, and they were the people that were there when I was there. And I said, that's great. He told them I was coming in. He called me back, said they're ready for you when you got here. So I got lucky that I was able to contact them, and they were excellent. I was lucky the weather was good for the helicopter to fly, and that can be a treacherous thing if it was too cloudy. And then I was obviously brought to UVA, which has an excellent neuroradiology and neurosurgery department. And then, I was taken to UVA, where a lot of the medical team remembered me from my time at the hospital there. So, and my wife was able to utilize that a little bit when needed. We knew know the chairman of the department of radiology, things like that, and the neurosurgeons and neuroradiologists. So I was very lucky. So, I kind of go through that. This is, my perspective and my story, but my family could easily be telling their side, and they have a different perspective. And some of those things are, I do remember talking to one of my daughters probably about a year or so ago. And I said, I think I remember talking to you when I was in the community hospital. She said, yes, we did talk. And I wasn't sure. She said, I remember it. And I wasn't sure that was going to be the last time I was going to ever speak to you again. Again, luckily I am here. But I think for all of our family, it's brought more reality to how life precious can be. Again, I was being very cool and collected in the community hospital. And as Amy had to go back to the hotel to get ready to drive, she asked the nurse, it was this serious? And the nurse said, it is definitely serious, and he could die, and you ought to get your daughters, who were in college at the time, to UVA. And then my wife basically had to drive 3 hours in the mountains, not sure if I'd be alive when she got to UVA. And there was no good cell phone coverage. So obviously very difficult time. So at UVA, and this stuff is basically from the chart and what my wife and family told me, but they did do a CT angiogram, a catheter angiogram, all were negative for aneurysm. I likely had a ruptured vein. And then this is the CT I want to show you. That this was taken at 1:23 in the morning on October 27th. So about maybe 13 hours after the initial CT. And in the interval, they placed a extraventricular drain through the right frontal region into the foramen Monroe, good location. But and then there's the air there. But in the interval, the ventricles have increased in size. You lose that gray-white differentiation, and you lose the sulcine gyrate, except for that left frontal region. So my brain was very swollen at that time. And again, there's a little bit more blood in the ventricles. So, again, to me, it shows this is how scary it was, and how lucky I was with all the things, being in the right place at the right time. And, again, from my family's point of view, it was a difficult time for them. But they had to become my advocates. Normally, especially as a physician, I could advocate for myself. In this case, I couldn't. And a couple of things, and they were relatively minor, but just some examples. But my wife had said, maybe about 3 or 4 days into my hospitalization, she said I was able to still see things. I normally wear contacts. And she said, does he still have his contacts in? And they're like, let's check. I don't know. So they checked, and I still had my contacts in. So that was a good thing to get rid of. I wasn't eating very well, and so they wanted to give me supplementation. And they, I guess they started giving me Ensure. My wife is like, he's lactose intolerant. That's probably not good for them. He said, yes. They said, yes, that you're right. And so they switched me to something else. But, I think that it's always important to have advocates. It's very helpful. And so I was very lucky that my wife and my daughters could be my advocates. At the time, my wife had said that she was, she couldn't do much at the time. And the only thing really she could do was pray. And she said she went to the, UVA chapel very often. And she actually said that there was a chaplain resident there, and we've tried to find out who it is. I'm still working on it, but there was a chaplain resident who, I guess, talked with my wife and gave her a card and said, if you need me, let me know. And I guess it was one time my wife was very upset, and she contacted the chapel resident, and she said, let's meet here in the chapel, whatever. They went and met in an office and they prayed, and Amy found it very, very helpful. It's another person who was very inspiring. And so I've actually given this talk now to chaplain residents, probably about 15, 20 times. So, that's it. Again, I think it's important to realize that there's so many parts of the team that can make a difference on the success and the outcome of the patient, including chaplains, including nurses, including medical students, including radiology technologists. And at the time, my family and medical team didn't know if my deficits would be permanent. I was definitely speaking, they told me I was speaking slower. I was weak, physically slower. And, at the time, they didn't know if that was going to become permanent or not. So, another thing, they did do a repeat catheter angiogram just to confirm I did not have an aneurysm. And that was also negative. I was there for 2 weeks, and I don't remember any of it, which is kind of a weird thing. This is me leaving the hospital, and you can see that this is where they shaved my head to put that drain in, and they took it out. They didn't want me flying, so my brother came in and drove with my wife with me in the passenger seat. We drove from Virginia to Dallas, and again, I don't remember any of that. I started rehabilitation November 30th, 2015. So just about a month after my hemorrhage, probably a week or two after I got home. And it was 6.5 hours a day for 1 year, 4 days a week. And I actually finished on November 30th, 2016 by chance. And it was 2 hours of PT, 2 hours of occupational therapy, 2 hours of speech therapy with a half an hour for lunch. And it was mainly working, there was mainly working on my cognitive and trying to improve my cognitive abilities. In addition, working on my balance and my speed and things like the physical speed. Some of the things I remember from my rehabilitation, I do remember getting a couple EEGs, which is where they put some probes on your head to see if there's any seizure focus. Patients with subarachnoid hemorrhage are at risk for seizures. So they had me on anti-seizure medicine until they proved that I didn't have seizures. But that was kind of a weird thing. They were putting probes on your head. I did do a neuropsych exam, I think in January of 2016, and then another one probably the summer of 2017. And that's really the only exam where they have, as far as I know, that they have controls of where you should be. And you sit there for 4 or 5 hours doing different exercises with a neuropsychologist. And it was a draining exam. And I was about 2 standard deviations below the mean. And it was 2 standard deviations below the mean on both exams. I was trying very, very hard to try to get back to work. And so in addition to doing this 6.5 hours a day, 4 days a week, I was like, what else can I do? And so I thought, okay, let me do some brain games on my phone. So there's a couple Lumosity and a couple other games that I would do. And then I also thought it was a really good idea stimulate my brain to relearn Spanish. I learned Spanish in high school or college and hadn't really used it after that for like 20 years. And so I started doing that, and I'm still doing that. And it's been a lot of fun, and it's really good for me to be able to work on the conjugation and the different tenses. And it's useful. In Texas, if you have a brain injury, you have to voluntarily not drive until you're cleared to take the driving test again by your physician and therapy team. So I was not able to drive probably for at least 6 months. And then, had to take the driving test. And that was, it definitely gave me more autonomy, but I was again nervous the first time I was driving again. And then I actually started giving this presentation to patients at the end of my rehabilitation. And one weekend, I just wrote down what I was going through, and I made a PowerPoint. And at the rehab place I was at, the therapist would give a talk to the patients once a week. And so I asked them, towards the end of my therapy, I said, can I give it to the patients? They said, sure. And it's been very fulfilling. And like I said, I'm now over about 100 times I've given the talk. So, and I think that also goes to, a lot of my time now is setting up presentations, giving a presentation, learning Spanish. And so you just never know what life's going to bring. Some of the things that from my rehab, some of the issues that I've felt like that I've found or kind of figured out for myself. One is, you don't know how you would have performed prior to the injury. It's not like you go to the rehab place right before your injury and have something to shoot for. You just don't know. There aren't controls. So that was one thing that was extremely helpful. Well, it wasn't helpful. It was extremely difficult that I just didn't know what to shoot for. And all you can do is just try your best and improve because you just didn't know. And it was really hard to know how I was progressing. And in fact, there was some times where I just declined. I remember doing some studies, some tests, and I was getting like 85% on it. And then the next day I was at 50%, had no idea why. And that was towards the end of my therapy. And I think that was one of the times where I was like, it kind of became clear to me that I wasn't going to be able to get back to work. You also don't know how much function you're going to have at the end of your rehab. And I think that can be difficult. Again, you don't know what to shoot for or when your plateau is going to be. And I remember it was really, I was nervous the first time doing things like drinking coffee and exercising and driving and things like that. And things you now take for granted for a normal person, they were not easy for me, especially when I first started up again. And for me, this is really an invisible disease. If you saw me, you wouldn't be able to tell that I have, things going on. And it's not a visible injury. I actually gave this talk to the radiology department at one of their banquets, and one of my attendings came up to me at the end and he said, I appreciate your perspective. They had a son who had a brain tumor, had brain surgery, and was having cognitive issues. And they said that the son told one of my attendings that he was upset. He was like, I almost wish I had a broken leg with a cast so people can see that I have an injury. And it's something you just can't see. And I remember at times I have, a little scar, I think, from that drain that they placed. And sometimes I'm thinking, okay, it would be nice for people to see it. But it is what it is. And again, I look at it as a blessing and a curse, mainly a blessing, but it can be difficult. And this was a slide that I found on the internet. And so for me, what a lot of people with brain injury, you look fine. What's above the water is all you see. What you don't see is everything else going on. And I'm just going to hit the stuff that I have: the fatigue, the headaches, difficulty processing, memory problems, concentration issues, sleep disturbance, probably some personality changes. But I think this applies to so many things. And I think it's important as a healthcare provider or just in general as a person to realize what you see, especially in this Facebook world. What you see of everybody looking fine and everybody looking good is not usually the case. There's a lot of stuff going on, patients with cancer, psychiatric issues. And I think it's just important to remember that what you see is not always what's underneath. So a big thing for me was, the big question was, could I get back to work or not? And because of these continuous symptoms of fatigue, cognitive issues, and headaches, and as a physician, we take the Hippocratic Oath of doing no harm. And especially as a radiologist, if I consistently missed cancers, pulmonary embolism, appendicitis, I could be killing people. And given all that, I was never released to go back to work. And in January 2017, I had officially retired. So I'm really at this new normal, and some of those things of this new normal is I have to focus on one thing at a time. I cannot multitask. And I used to be very good at that. I was doing a lot of pain management injections. And with that, I would be reading a case. The technologist would come in, say, there's a patient on the table, like get up, go do that, injection or procedure, come back and just start up where I was. And I cannot do that now. I really just I can only do one thing at a time. I have to process my thoughts before I respond, and I have difficulty when I'm interrupted, and that makes it really difficult for me to interact in groups. And, it's interesting. I think in some ways I'm a better listener than I think most people probably, because I have to sit there and really concentrate on what people are saying, then process it, and then try to speak. But by the time I get something out, usually someone else is already talking. And I've talked this over with my wife, and we said, if we're with a couple and they ask a question to both of us, it was happening where she would answer all the time because she was processing better than I was. Could she just let me occasionally answer? And she's done that, and she's been incredible. And that's a big help. I do struggle at times in a social setting where I'm aware I don't want to be being a brain injury survivor as my only thing I can talk about. So it comes up in conversation later that night. I'm like, oh, did this come up too much? It's just something that I think we're always tough on ourselves. And I just try to be aware I don't want to be solely talking about myself as a brain injury survivor. I do get frustrated that I can't remember important things in people's lives. I do have to write a lot of notes to myself, and my good friends understand that I am at this new normal. And then, I make at least probably 2 or 3 mistakes a day that I know of. My wife knows more of them, but the bigger mistakes in some ways helps me kind of reinforce that there was, I probably make at least a couple times a week that there was no way that I could work. So I want to now kind of transition to the second part of the talk, kind of what people say and what's helped me through the process. This is a photo of my wife and 2 daughters. My wife's in the red. So some of the things I like to hear, and again, this is more initially, but I liked it when people said, my thoughts and prayers are with you. Prior to my hemorrhage, I always kind of thought that was a cheesy thing to say, but having gone through this, I think that I can tell if people mean it. And if people mean it, I think it's a very, very nice thing to say. I also appreciate it when people were saying, again, this is all more when it was acute, but they were lighting candles for me or adding me to prayer lists. And again, it was just very, very thoughtful that people cared about me. And in some ways, actually, I just want to take a quick thing. I do remember a time, probably maybe 6 months after my hemorrhage, I had to go by the hospital in the evening one time. I can't remember why. And there was a night secretary who I saw very frequently when I was working. She hadn't seen me. And again, this is probably 6 months or a year out. And she was just so happy to see me. And it was just so heartwarming to me that people cared for me. And I appreciated that. Another thing that I did find that my family has felt that it was more helpful when people were just volunteer help, rather than saying, let me know what I can do for you. So we've done that. My family's done that now, where we're just, if somebody's going through something, we'll just say, what night can I bring dinner by? Rather than saying, let me know what I can do for you. The let me know what I can do for you puts more of an onus on the person going through the issue. And I think that's just very helpful. Also, it was really, really nice. I used to get, again, more acutely, but texts, phone calls, cards from people who I worked with. And it was just very, very heartwarming to me. And it was actually really nice. As you mentioned in the introduction, I got voted one of the best doctors in Dallas for the probably 15 years prior to my hemorrhage. And there's only about 10 radiologists a year that get it. And the physicians, the referring physicians have to write your name in. And I always was just very proud of that. But I actually got it for the 3 years following my hemorrhage. And it was, it was very nice. And especially knowing that I cannot practice now, it really makes me feel good that knowing that I was a really good physician, that the patients and the clinicians appreciated my the work that I did. And but I can't do it anymore. And that's the way it is. I appreciate when people understand, again, my new normal, that they understand that I make mistakes, and some people said, I'm just glad you're around, that people understand that I get antsy, I get tired, and it's nice when people understand this new normal. I have a quick funny story on that one. One of my friends invited me to the Dallas Stars game, and during the first period, he's like, oh, I know you get tired, so if we have to leave early, we can. And so I said, actually, I took a nap today, so I'm good, but I appreciate it. It's actually in my talk. And so after the second period, he's like, oh, do you want to leave? I'm like, I'm okay, thank you. He said, well, I want to leave. So I was like, okay, that's all good. But again, being funny, but I do really, really appreciate it when people understand that. And then this one really, I think, is really, this next one, how are you doing today? I really like that. I found this in a book by Sheryl Sandberg, who is the COO of Facebook, and she wrote a book called Option B about how her husband passed away suddenly while on vacation. And it was just a small section in the book. But basically she was writing, she said she didn't like it when people were saying, how are you doing? She's like, she wrote in the book, my husband passed away, I'm not doing well. I'd rather people say, how are you doing today? And that one word today just makes all the difference. And, I think that's extremely helpful. I try to remember that, but I just think that one word, how are you doing today? And for me, it makes a huge difference as well, especially if I haven't seen anybody, and again, more recent to my retirement. But if somebody says, how are you doing? I wrestle with myself. Do I start telling them some of my problems and why I can't work and things like that? But if someone says, how are you doing today? It changes the whole thing. And it's going to be a good day. I'm spending time with my wife, my dog, and things like that. I appreciate it. And I would be nice if people recognize that it's hard to have this new normal. I don't think I've ever had anybody say this, but it would be nice if people said, I know it must be frustrating to have this new normal, or I can only imagine what you're going through. These kind of things would provide validation, and it's better than that's okay, we all forget things. And I've given this talk probably to about 20 brain injury survivor groups. And as a brain injury survivor, and I hate to say hate, but we really kind of hate that, because that's okay, we all forget things is, your person's trying to be nice. They're trying to make you feel like, oh, it's not that big of a deal, but it puts you on a defensive. And if somebody says that, I just kind of, I just don't engage. Because what I'm going through, what brain injury survivors are going through, is totally different than this normal aging process. And I just think it's important as a person to listen, try to validate rather than tell your problems to another person. So what's helped me through the process? Definitely my family and friends. The medical rehab staff did a great job. The rehab patients were very, very inspiring. They were happy to be alive. I definitely made good decisions. I've had to make practical changes. There were some books that I really like, including Happiness Makeover, and I've had to adapt my goals. And I'm going to go through these here in a sec. This is a photo of my wife in the red and my two daughters. And this was taken on October 26, 2016, exactly 1 year after my hemorrhage. And just a few things I want to point out. I could have easily not been in this photo. this 50% mortality, 1 out of 2 people would have died. And I'm extremely lucky that I am around. And my wife has been incredible. That we've had, it's definitely been a role reversal. She's, in some ways she's more empowered now. But we've had to work on our communication to just work through this new normal and how it affects both of us. And it's just been, she's been great. And my 2 daughters have been very good and understanding that I'm at a new normal and I'm just not where I was. I think it's important to try to make good decisions because you never know when things are going to come up. One of the things, disability and life insurance, you never anticipate having to use it. And I think it's important, especially as a physician, to get disability insurance and life insurance, but definitely disability insurance. Another thing that helped us was we lived and continue to live within our means. And, I think that's just important because you never know what's going to happen. I think having outside interest in photography and spending time with my family helped with this unexpected transition. And then being a doctor was not my sole identity. I try to be a good person, and all these things help make it easier on that unexpected transition. So some of the practical changes I've had to make, I have to get extra sleep. I write things down all the time. I primarily use my iCal and I put tasks down for that day and appointments. And one of the things that I've had to do is if I have an appointment, I look at it the day before and I put an alarm on my phone. So today, my time, it started 11 o'clock. So at 10:30 and 10:40, I put alarms on my phone just to make sure I don't forget things because I have a problem with time. I almost have to be OCD and to remember things and be in routines and some of those, rituals. It's one of the things I take an inhaler in the morning and at night. So when I go into the bathroom, I open a drawer to the inhaler and the drawer is open. I know I need to take the inhaler, but sometimes if the drawer is closed, I don't know it. I can't remember if I took the inhaler and closed it or if I totally forgot to open the drawer. So sometimes I take 4 puffs instead of 2, and that's okay. I've had important emails read, and that's, again, another additional responsibility for my wife. And then lastly, it was interesting. Like I said, I had problems with time, and I started giving this presentation during my time at rehab, and I wound up going a week early to give the talk. And they said, oh, it's next week. And I was kind of upset about it. I was talking to one of the other patients she saw, I was upset. She said, I look at things, are my mistakes deadly or are my mistakes fatal? If I forget my medicines over 3-4 days, or if I walk in front of a bus, that's a fatal mistake or a deadly mistake. But if not, you don't like making the mistakes, but just keep it in perspective. And that's been a helpful thing to me. There's a book that I really like called The Happiness Maker. I've read it before I got hurt and then after. And it was by M.J. Ryan. And it's kind of a Buddhist way of looking at things. And a couple of things she had in there that I really like is she said, you don't know the end of the story. And it's a Buddhist story of a villager's horse runs away. Another villager comes up and says, aren't you upset you lost your horse? And the guy says, I don't know the end of the story. 2 or 3 days later, the horse comes back with another horse. And so now he has 2 horses. And that's how it ends in the book. But the Buddha story continues that the villager has a son, got on one of the horses, falls off, breaks his leg. Somebody comes up and says, aren't you upset your son broke his leg? I don't know the end of the story, is what he says. And then within the week, a war breaks out and the son doesn't need to go to war because he has a broken leg. So a lot of things, you just don't know why things happen. And you kind of just have to deal with that new normal. She says every night you should review, and I do this a couple times a day. What were you satisfied about that day? What did you enjoy about that day? What are you thankful for? What are you hopeful for? So I remember, and I added hopeful about 2 years ago. So I remember satisfied, enjoyed, thankful, and hopeful. So for me, satisfied, good father, good husband, good son, gave a good talk, enjoyed talking with you guys today, enjoyed spending time with my wife, and thankful I'm alive. I'm thankful we have a house and a home. I'm thankful my kids and we're happy and healthy. And, again, we're thankful we have a house and a home. I'm hopeful that this talk went well, that we stay safe and healthy. So that's what I go through. And it actually is very helpful for me because it helps me force going through what I did today, which is a problem for me. So satisfied, enjoyed, thankful, and hopeful. And then, I've had to adapt my goals. And so this was a intake form I filled out my first day of therapy. And this was on November 30th, 2015. And just want to go to the bottom, and it says, what do I hope my life is like when I leave Pate? And I wrote down back to normal and function in my job. I didn't achieve either one of those. I was not able to get back to work as a radiologist. I did not achieve that. And I did not get back to normal. And I'm at this new normal. And so I just think it's important to try to set goals, but reset those goals if you can't achieve it. So my new goals are, to be a good father, good husband, continue to learn Spanish, continue to give this talk to whoever wants to listen. My one goal is I hope to give this talk in Spanish one day. So, I just think it's important to be able to do that and continue working on photography. So this is a photo I took of the Grand Canyon. I got lucky with the clouds. So take home points, reviewed quickly some of the things that I found helpful as a practicing physician. Hopefully, emphasized that the ancillary staff are extremely important part of the team in the success of the patient, that live life to the fullest. They can change in an instant. We have that selfie from, again, an hour before this happened. Reviewed what's helped me in my recovery, what people say, that's helpful. And again, I just want to reiterate that, I think it's important to, follow the golden rule and treat people the way you'd want to get treated. And you really have an unknown impact on people. And again, for me, just multiple members of the team and probably people I don't even know had such an impact on me, but the radiology technologist, the nurse, the chaplain resident. And so I just think you, again, have to be comfortable with that uncertainty of just treating the people the way you want to get treated. And there was a good book, just to bring us home, by Mitch Albom, The 5 People You Meet in Heaven. And basically it was a made-up story of a guy who dies, an angel comes down and basically shows him 5 different people he had an impact on and he had no idea of. And so I just think that's, you have to be comfortable with that. And just a few kind of quotes here at the end with some of my photos. This is a photo I took of New York from Brooklyn. From Charles Dickens, says, reflect upon your present blessings, of which every man has many, not your past misfortunes, of which all men have some. And so, to me, this is, try to concentrate on the present, try to concentrate on good things, try not to focus on the past and on the bad things in your past, and just keep on trying to look forward. And I think understand, again, going back in this Facebook world, that everybody's got stuff, and don't, try not to focus on the bad things in your life. At some point, you just have to let go of what you thought should happen and live what is happening. I was on this road, I hit a fork in the road, and I'm now on this new road, trying to enjoy this new road. God gave Adam a secret, and that secret was not how to begin again, but how to begin. Not how to begin, but how to begin again. And that was said by Elie Wiesel, who was a Holocaust survivor. And I kind of look at this as Adam and Eve were in the Garden of Eden. They were kicked out of the Garden of Eden, which was paradise, and they were kicked out into essentially real life. And in some ways, that was a gift that God gave to Adam and Eve, that they had to learn how to begin again outside in the real world. And then lastly, the biggest mistake in life is you think that you have time. Time is free, but it is priceless. You can't own it, but you can use it. You can't keep it, but you can spend it. Once it's lost, you can never get it back. And that was given by Buddha. And I just think, again, going back to, that selfie of my wife and I, time is precious. And I think try to enjoy the present and try to enjoy the time you have. So thank you very much for your attention. I'm happy to take questions.
Dr. Cohn, thank you so much for sharing your unique perspective from your experience.
Thank you.
So it's so clear that you are an outstanding and empathetic practicing radiologist. I loved hearing how much you've grown personally beyond that and recognizing your identity beyond a radiologist or a physician as a result of such a traumatic experience and taking that unanticipated road. As I mentioned during my intro, I really hope this has helped to enlighten us all, both personally and professionally. We can all, cognitively appreciate that patients and learners we serve have, often complex lives beyond what we see, the tip of the iceberg, if you will. But it was really helpful to hear your perspective and from your unique experience. Are there others who have any comments or some questions that you might like to ask Dr. Cohn?
Dr. Cohn, this is Lee Learman. I'm the Dean at Virginia Tech Curlin School of Medicine. Thank you so much for taking us through your experience and how you're living your life productively. I wrote down the Seth of things because I found myself traveling to the same place in my own appreciation log at the end of the day, but I didn't think of it as those four components. So I really thank you very much for that. I was curious around the unique perspective of a physician experiencing what you did, and whether, in the possible future of returning to a prior practice, what would that have meant to you? What you took out of that experience?
No, and I think that's a great question. I think, I tried to be, I'm not sure. I always tried to put myself in, and I hate to say always, but I did always try to put myself in the perspective of, especially as a radiologist, I try to put myself in the perspective of the referring physician or the patient. And I think that's important because I would be sitting there sometimes, like if I saw a finding, I'd kind of wrestle with myself. Okay, if I was the patient or the physician, what I want to know, and most of the time I would go ahead and call them, and I would err on the side of that. So I'm not sure it would have changed much, and I hate to say that because then it's like, okay, what did we just spend the last hour on? But I think going back to trying to treat people, the patients and the clinicians, the way you'd want to get treated, I think being communicative, I think that's what I would say.
I appreciated thank you. I appreciated that your iceberg that you showed with respect to folks who've had an experience such as yours. But I think, that is such a common way of thinking about, or a useful way of thinking about anyone we might meet.
Yep. Exactly.
And how they present themselves. I don't know if folks have had the chance to watch that empathy video from Cleveland Clinic. It's old now, but it does a very nice job of popping up some of the backstory of each person that's just wandering through a health system on a typical day. Just reminding us of all of the kind of richness of their experience, and in some cases suffering or joy that we don't always experience in just our first impressions.
Yeah.
Thank you.
I think it is an interesting. Actually, that again, I think it's just important to as a brain injury survivor, like I said earlier, and I don't mean to be negative, but I forget things too. It is just people don't understand what I go through. Again, knock on wood, I can live by doing these routines. I can live a normal life with this new normal. But I think it would be nicer if people understood and try to validate. And again, I've gone to some physician's office and they're like, oh, you look good. And I'm like, you have no idea the stuff that I have to do. I have to write a note to myself, if I'm going to a physician on Tuesday, I write notes to myself, okay, write down what I want to ask them. They have no idea what you're going through. So I think going back to your empathy, I think it's important to try to be empathetic, and try to validate what the person's going through. I have one other thing. Sorry, go back on what you would say, how you would change things. Just going back to your other question, one thing that I always did ask, because I would do a lot of pain management injections, and I would do them on local anesthesia. It would probably take me 3 or 4 minutes to do a pain management injection. One of the questions I would pretty much always ask is what kind of work do you do? And I did that to try to get people to talk about themselves, because if you get somebody to talk about themselves, it gets their mind off of what you're doing. But having gone through what I've gone through, I would not ask that question now, because for me, especially initially, I'm pretty young. This happened when I was 48, 49. Somebody asked me that question and I say I'm retired. I got to look like, oh, you must be rich. And if I got that look, I'm like, well, I had a brain bleed. So that would be one thing that I would change is maybe asking what's your typical day? What's your typical day like, or things like that. Again, there are little things that can make it, little things that you say as a physician or a person can make a big difference in how you treat a patient or how they take it.
Thank you.
Sure.
Thank you, Dean Lehrman. I have to say that's one of my favorite videos, that empathy video. And I was going to mention it also. If you all have not had a chance to review it, I believe the dean posted a link right in the chat. But it is worth the watch for sure. And it's very short. Well, we are right at time. Thank you all so much for being here. Again, please get out there. Take some deep breaths outside. It is absolutely gorgeous out there. And thank you, Dr. Cohn, for this fabulous shift in perspective for us all.
My pleasure. Thank you.
Enjoy the rest of your day, everybody.
Thank you.